I've been using this for 8 to 10 years with very good results and with very happy patients. And one that comes to mind is patients who have a fair amount of excessive sweating, either in their armpits, their palms, and they don't want to shake anybody's hand, or their feet. And we learned that if we inject the little glands that cause the sweating, then with Botox we can diminish significantly to a point of these patients not being normal in their sweat production for up to 8 months, a year even at times. Another unusual use of Botox is for patients who have bruxism. This is a medical name for people who grind their teeth. What happens with patients with bruxism is that they have this muscle so well developed, their faces become rectangular in shape. They don't like these bulges. So you do, with a Botox injection, two things. You help them from a standpoint of function, because their grinding diminishes significantly. Many of them didn't have to use a night guard anymore. And the other thing that you accomplish, the shape of their faces changes, whereby it goes from a rectangular into an oval shape. An oval shape is sign of youth. Another unusual use for Botox injections is patients with gummy smile. And there is a muscle which is called the levator labii superioris aliquinasi. So it's a strange, long Latin name. It's a muscle that pulls up the lip. And in certain patients, because different patients have different smile patterns, and this has been studied extensively. In some patients, that muscle is very strong. If you inject that muscle, you drop the lip very nicely, and the gums don't show anymore. As we get older, and especially in some patients, there's the muscle that pulls down the tip of the nose, depressor septinasi it's called in Latin. This muscle inserts from the tip of the nose to the upper lip. If we treat this muscle by knowing exactly where its place, its position is anatomically, with a little Botox, the nasal tip goes up by a millimeter or two, just sufficient. And also sufficient enough that the constant pulling down no longer is happening. Botox can also be used to lift up the corners of the mouth. It's not a facelift. It's not a replacement for a facelift, but there are many patients who just have this bitter appearance because the corners of the mouth are hanging down a little bit. There is, again, you need to know the musculature extremely well, and that's why surgeons are best equipped to use Botox. There's a little muscle called the depressor, which means pulling down, anguli, which means corner, oris, which means mouth. And by injecting these little muscles, the triangular little muscles on each side, all of a sudden the corners of the lip gets lifted up. Another use of Botox, and it's well proven that really works, is for migraine headaches. And the way this was discovered is that when we were doing endoscopic surgery for forehead wrinkles and eyebrow elevation, we also noticed that many of those patients, if they had migraine headaches, they no longer had them. Having seen this, the question came, could we just inject Botox in the areas of the face that the musculature is released with endoscopic surgery and see whether that would work for migraine headaches? And it does. And since then it's been developed that depending on where the migraine headache is, whether the forehead, on the back of the head, etc., there are certain trigger points that can be injected with Botox, and the migraine headaches are averted. It doesn't work as well when the headache is already there, but it works proactively so it doesn't come back.